My name is Kelci. I'm the operations coordinator for First Watch Wellness, and I'm also certified as a substance abuse counselor in the state of Utah. For me, the simplest way to define addiction is when you continue to engage in a behavior or use a substance even when you're experiencing negative consequences. You look at someone engaging in those really terrible behaviors and likely hurting the people around them, and it's hard to understand why they would seemingly choose to keep engaging that behavior. Why wouldn't they just stop, right? Addiction is actually a disease of the brain. It might start with a choice to use or engage in a specific behavior, but over time that choice gets taken away or at least very severely diminished. Addictive substances have one thing in common. They all release a flood of dopamine in the brain. And dopamine is a good thing. It makes us feel happy. It tells us that things are pleasurable and they're good for survival. So normal activities that release dopamine are things like eating food, healthy social interactions, even like sexual activity. Those things are all necessary for survival as an individual or as a species. Those release normal amounts of dopamine. The problem with addictive substances is that they release a flood of dopamine, and it sends signals to other parts of our brain saying to remember this, that we need to do this again. Our prefrontal cortex is the part of our brain that is responsible for executive function. Also allows us to assign personal and moral meaning to things. And this part of our brain kind of becomes under responsive or underactive when addiction takes place. Our midbrain or our amygdala, that pleasure and reward pathway in the brain, starts to hijack the prefrontal cortex, and this concept is called hypofrontality. And this can also be a reason why people who are active in their addiction seem to throw away all their morals and values in favor of continuing those negative behaviors. Genetics do play a role, but again, there is no formula to know whether or not someone is prone to an addiction or not. It's a really complex interaction of risk factors and protective factors. Risk factors can be things like growing up in poverty or not having a supportive family environment. Trauma is definitely the number one highest risk factor for addiction. As we know, first responders experience a lot of trauma on the job. It can be really easy to want to cope with that trauma, for example, by having a couple beers after work. Kind of forget about what happened during the day or what happened during that stressful call. The problem is 4 beers turns into 6 beers, turns into 12 beers. And over time, your brain needs more and more of that substance to get that dopamine. But from a trauma-informed perspective, your brain also is just wanting to kind of numb and block out that trauma that you've been experiencing at work. When we act in a way that does not align with our personal values, we tend to experience shame. Shame is perceived within our body the same way that we perceive physical pain, and we naturally want to avoid it. That's a totally normal response. Substances and acting out behaviors allow us to temporarily numb that feeling. The problem is, like we've been talking about, we over time require more and more to get that numbing effect. Addiction really thrives on shame, secrecy, and silence. And so reaching out to just one person in your support group, consider making an appointment with one of our First Watch clinicians. You're not as alone as you think you are. You're not broken. This is a very, very common thing among first responders. It's really important that you are able to be vulnerable and share what's going on. Everything you share with our clinicians is completely confidential. It will not be shared with your chief or with your commander. And we really want to help you get to the root of why you're engaging in these behaviors. There are so many other people in the same boat or who have been where you are, and you're not a failure, you're not broken, there's nothing wrong with you. It's important that you get the support you need. So reach out, whether that's to a First Watch clinician on the First Watch app, whether you go to an AA meeting or an NA meeting, whether you decide to talk to your spouse, just reach out and help you develop those healthy coping skills so that you can show up as a husband, as a father, as a first responder at work, and feel really good about the work you're doing.